Hi guys, I hope you're having a good evening. I had something come up this evening, so I'm going to go ahead and do your slides on a recording so that you can still view them, but it will just not be where we do it together. Sorry about that, but you'll still get all the information you need. Just waiting for them to upload. So we're doing chapter 20, urinary and male genitalia systems. I'm going to move myself in this corner over here. Okay, procedures involving the urinary system are reported using codes 50010 and 53899. Anatomic divisions are kidney, ureters, bladder, urethra. Procedures on prostate are either in the urinary or the male genitalia system. Further divided by the incision and excision. Okay, the kidney subheading includes codes 50010 to 50593. Endoscopy codes are assigned according to approach. Either a previously established stoma is used as an entry point, which is created by placing a catheter through the skin and into the kidney, or an incision used. When coding endoscopy procedures, the coder must identify the entry method in order to assign the right codes. So we'll just read through this slide. Endoscopy codes for procedures done through previously established stoma or incision. Most cystoscopy procedures have 0 global days, and a cystoscopy is a visual examination of urinary bladder by means of cystoscope. Okay, incisions. If something is found on the exploratory procedure and a corrective procedure ensues, do not bill for the exploratory procedure. Exploratory equals diagnostic. Caution, kidney located in the retroperitoneal area. Each has codes for procedures. Renal exploration, kidney diagnostic procedure 50010. No further procedures performed. Retroperitoneal area diagnostic procedure 49010. Renal abscess, kidney abscess 50020. If radiological supervision and interpretation were performed, see 75989. So that's a radiology code. Retroperitoneal abscess is 49060. Nephrostomy 50040, insertion of a catheter into the kidney with one end in kidney and one end outside the body. Nephrotomy 50045, exploration of inside of a kidney. No definitive procedure. Verify all CCI code edits to prevent unbundling. Nephrolithotomy 50060 through 50075, removal of calculus. It is important to know the difference in these terms and understand that the surgeon may start out performing a nephrotomy to explore the kidney and find a reason for the patient's urinary obstruction, and the procedure then becomes a nephrolithotomy when a calculus is found. How is an ESWL performed? The patient is placed on a water-filled cushion on his or her back, and while the patient is under general anesthesia, shock waves are targeted to the stones, which are pulverized with repeat shocks. What is the benefit of this? It breaks up large stones and makes them easier to pass. Percutaneous nephrostolethomy, PCNL, or lithotomy, removal of kidney calculus. So you have two different things there, your ESWL and your PCNL. Percutaneous and your ESL. I know some of these are hard to see. I'm sorry. Oh, I got to go back one. I'm sorry, guys. All right. So a nephrectomy, partial or total, radical excision of the kidney is 50220 through 50240. Radical removal of fascia, fatty tissue, regional lymph node, adrenal gland. A nephrectomy medical record documentation should indicate if the procedure was partial or total, laparoscopic or open, and if any structures were removed. Code 50225 describes a complicated nephrectomy because of previous surgery on the same kidney. Ablation. Chirosurgery is 50250. Laparoscopic is 50542. And percutaneous is 50593. I know that this is, let me see if I can move this up here. Okay. Renal transplant, 50300 through 50380. Bench back work, retrieval of organ. Deceased is going to be 50300. Living is 50320 open and 50547 laparoscopic. Preparation of organ for deceased is 50323 and living is 50325. Transplantation without nephrectomy is 50360. With nephrectomy is 50365. Add modifier 50 for bilateral procedure, unless your code specifies bilateral procedure. Aspiration, catheters, injections, and radiography, insertion of guide wires, tube changes, usually reported with the radiology component. Those are all introductions. These category codes include extensive notes, which should be read by coders before they code in this area. So now we're moving on to repair. Usually congenital defect, but it can be acquired. Closure of a fistula depends on the approach. It will either be abdominal or thoracic. Pyeloplasty, repair of the uteropelvic junction, the UPI. Simple is 50400. Complicated is 50405. Closure of fistula, abnormal opening, 50520 and 50520 or through 50526. Laparoscopy. Ablation of renal, cyst, 50541. Lesion, 50542. Chiroablation, 50250. And percutaneous is 50593. What are the codes in this category based on? They are actually based on the extent of the procedure. Renal endoscopic procedures are less invasive than open procedures and often can be performed on an outpatient basis. I'm going to just give a minute and you guys can read through this slide, but that was what I wanted to point out here. Renal endoscopic procedures are less invasive than open procedures and can often be performed on an outpatient basis. Okay, this word just cracks me up, so I'm going to try not to smile when I say it. Ureter. The ureter subheadings includes codes from 50600 through 50980. The endoscopy codes in this subheading are 50951 through 50980, are used to report procedures that involve an established stoma. They involve an established stoma. They're divided based on type of procedure, incision or excision. Laparoscopy codes describe surgical procedures, and codes may be bilateral or unilateral. Oops, sorry, went too far. Okay. Incision biopsy / biopsy is 50600 through 50630. Report open procedures, explore or drain 50600, insert indwelling stent 50605, remove calculus 50610 through 50630 based on location of upper third, middle third, or lower third. That'll be indicated in your medical record. Bladder cuff is the tissue that connects the ureter to the bladder. Excision of the bladder cuff is only coded if it is the only procedure performed. If it is performed in conjunction with another procedure, it is bundled in and not reported separately. Manometric studies are tests to measure kidney and ureter flow and pressure. So excisions are uterectomy is 50650 and 50660. Bladder cuff excision or total excision. Introduction, report injections, manometric measure pressure, studies change of stents/tubes. Laparoscopy and endoscopy. The endoscopic category can be intimidating due to the medical terminology used in this category. Great knowledge of medical terminology will increase your coding accuracy. I will try to make sure you guys get some extra terminology so that will help you in this area. Laparoscopic placement of uteral stent 50947 and 50948. Endoscopy codes 50951 through 50980 for procedure through established stoma. The bladder subheading 51020 through 51597 includes many usual services. For example, incision and excision, but it also contained urodynamic category. When coding from this subheading, it will help to know the anatomy of the bladder. There's a bladder diagram here for you, and it's also in your book. It's figure 20.8. Bladder mini bundled codes, Example, urethral dilation is included with insertion of cystoscope. Read all descriptions carefully for site, technique, and the reason for the procedure. Aspirations are done to remove urine from the bladder. If imaging guidance is used, this is separately reported. A urachal cyst is found between the umbilicus and bladder dome and is often found in young children when the cyst becomes infected. So incision in this category is 51020 and 51080. Cystotomy 51020 through 51045 for lesion destruction, insertion of radioactive material. I'm sorry guys, I get tongue-tied. Fulguration used use of electrical current. Sorry, I had to take a minute and smile. Suprapubic catheter placement is 51102. Excision 51500 through 51597. Cystomies and cysternectomies 51520 through 51596. Codes divided based on the extent of the procedure. Lots of these codes are based on the extent. You just have to pay close attention to your medical record or your coding scenarios. Okay, the catheterization can be simple, a Foley, or complicated, anatomical anomaly, or catheter fracture. The carcinogenic agent that is instilled in the bladder is retained for a period of time with the patient lying down. The agent is then drained and the treatment is concluded. So injection procedures 51600 through 51610 for Urethroscopy, radiographic S&I reported separately. Installation of an anti-carcinogenic agent via a catheter for bladder cancer, retention time included. Procedures related to motion and flow of urine, motor and sensory function, used to diagnose urine flow, obstructions, bundled, as usual, necessary instruments, equipment, supplies, and technical assistance. Always code urodynamic code in addition to all other cysto codes if both are performed. Modifier 51 is reported for multiple procedures. That's about urodynamics, 51725 through 51798. Define cystoplasty. Well, plasty is a repair, right? So cystoplasty is the repair of the bladder. Urethroplasty is the repair of the bladder and the urethra. And the urethroplexy is the repair of the urinary incontinence. Sorry. So we have repair codes here and laparoscopy codes here, and I'll let you read through those. Endoscopy, cystoscopy, urethroscopy, and Cystourethroscopy. Take special care in this category to read codes carefully. All of the procedures included are found in the description. Many third-party payers have a list of edits on codes that cannot be reported with other codes. So 52000 through 52010, there are many combination codes. Notes before 52000 indicate that included are medotomy, urethral calibration, urethral dilation, urethroscopy, cystoscopy, and urethral catheterization, and etc. So you need to kind of go through, your notes before 52000 and do some highlighting and making notes. Going to continue on with this same category. There we go. Sorry, I got a little button happy. 52000 is assigned for IVP if appropriate. 52005 is assigned for retrograde pyelogram. When coding Cystourethroscopies with dilation, ask the following questions. Is the patient male or female? Is this an initial or subsequent procedure? Was general or spinal anesthesia used? Additional time/effort of the second procedure, and modifier 22. So what is modifier 22? I want to read it. I don't want to make a mistake. So modifier 22 is increased procedural service, because that means we had extra time. Okay, Transurethral Surgery, 52204 through 52355. Divided by codes for urethral, bladder, or ureter pelvis. As in other areas, if a procedure starts as a diagnostic procedure and turns into a surgical procedure, the diagnostic procedure is not billed. It's bundled into the procedure. Vesical neck and prostate. Codes in this category are actually based on approach. Watch the wording, whether it is a resection or an incision, a resection or an incision. It contains codes for transurethral resection of the prostate, which is a TURP. Example 52601, complete transurethral electrosurgical resection of the prostate. Other approaches are reported with the 55801 through a 55845. Example, 55801 reports a removal of the prostate gland, a prostatectomy, through an incision in the perineum, a perineum. This is about vesical neck and prostate, 52400 and 52700. This is going to be our last slide today. Many codes are divided based on whether the patient is male or female. The dilation codes under the manipulation category are based on whether it's an initial or subsequent and if the patient is male or female. So excision for the urethra is 53200 through 53275. 53210 is female and 53215 is male. Repair 53400 through 53520. Urethroplasty may be 1 or 2 stages. Some codes divided based on male or female. Manipulation 53600 through 53665. Stretches or narrowed passage. Well, I appreciate you guys so much for joining in and listening. Just jot down your notes, highlight pertinent information in your step-by-step. Today is today Thursday? I think today is Thursday. It's 4/2. Yes, today is Thursday. So it's your Friday. I still have one more day to go. So this weekend, you guys just, for homework over the weekend, make sure that you've read chapter 20. Do your review at the end of your chapter and just work your exercises. And you can check your exercises in the back of the book. Monday, we'll do a Zoom and we'll go over the answers to your review. And we'll finish up the last few slides of this chapter. I hope you guys have a great weekend. Let me know if you need anything. Bye-bye.